With us right now is plastic surgeon Dr. Randall Weil. I mispronounced it a little earlier. And today he's here to talk about neck lifts. First, let me remind you that we will be taking your calls live on the air with any questions you have for Dr. Weil about plastic surgery. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, of course, any advice we give you today, you'll also want to consult your own physician. Welcome to the program.
Thank you so much.
Now, you want to talk about neck lifts, and that's relatively new, right? Because when it came to plastic surgery, you know, you'd see a person and they have a tight face and, you know, they have to put a scarf around their neck if it was sagging. Aren't usually the neck and the hands the telltale signs of the person's real age?
Yes, it is, no question about it. We can do some things about hands that are like non-surgical. We have some lasers that work fairly well. For the neck, not really.
Pretty tricky.
It is pretty tricky.
I mean, when you look at all the, you know, celebrity magazines, you'd go, oh, there's so-and-so, and you'd see this, and then, you know, but not anymore. You've come up with ways to fix crepiness. Mm-hmm.
Yes.
The turkey gobbler neck, or I'm sure there are many names for it.
Well, the turkey gobbler actually works well. Some people will have extra skin on the neck. Some people have extra fat, and some people have a combination of the two. I've spoken before about neck liposuction, which is very good for people who just mostly have extra fat, and you can get a nice contour back. But for those people who have some extra skin, especially men also have extra skin and not a lot of fat, then there's some procedures that can be done which are not really considered facelifts, but are more considered neck lifts, where the incisions are hidden.
And where do you hide an incision on the neck?
They're on the back of the ear, and they go into the hairline as well. And so you can return to a beautiful neck and still look like yourself. So a lot of people are concerned that they might look different if they have a facelift. So this is not that. This is just really working on the neck and the jowls as well.
Well, so you don't have to walk around with a turtleneck in the summer.
Right. A lot of times I'll see people who will come in after these and they'll have, you know, a lower cut dress, they'll be wearing pearls, something like that, whereas before they wouldn't want to show their neck.
Okay, so nuts and bolts of this, I mean, is this something that it takes a while to recover from? Is it major? Is it in the office?
Well, we call this a mini lift, though, so it's not a full facelift. But a mini lift, nevertheless, it would take probably about a week. I mean, I've had people that are in real estate and they want to get back selling homes again quickly. And they may be out 3-4 days, so you could wear something around the neck for a few days. But about a week, the stitches are out in about a week. And it takes about an hour to an hour and a half to do it. I have my own surgery center, so I do it there. You don't go to the hospital. And so it works quite well.
Now, we know that gravity does its job, and after a while things begin to fall again. How long does a neck lift last?
Oh, these would last probably 5 to 7 years, and maybe a little longer. A lot of it depends really on how what they're starting with. So if your elastic tissue is still good, which on a lot of people it is up until, you know, 60s or 70s, and then it may last at least 7 to 10 years.
Hey, you know, dermatologists have said, you know, there's really different types of skin on your body. The skin around the eyes is different than the face and the neck. It seems there's not a lot. I mean, it seems very thin in that area. Is it prone to the ravages of sun?
Yes. Yes, the neck is especially, because a lot of people, I think, kind of forget about putting sunscreen on the neck. So they put it on the face, maybe on the hands, but they tend not to put it on the neck. And the skin on the neck also doesn't have all of what we call the sebaceous glands, the oily glands, not as much as on the face either. So it does tend to age quicker and oftentimes worse than maybe the face.
And are there things you could do preventively? I mean, could you do neck exercises?
No, we see those all the time. I don't think they really work a lot. People have apparatuses they put in their mouth and all kinds of things, but I don't think they work that well, really.
So, but in terms of, like, you mentioned sunscreen, obviously, I mean, that's a gimme for any part of the body. They're saying now, really, you need, before you leave the house, that even when you're in the car, you know, you're getting exposure to the sun.
Correct.
Even if it's overcast, as we enjoy in San Francisco, pretty much every day of the summer.
You're still getting some of the rays. And really, it's some people think they've just put it on once and that'll last for hours and hours. No, you need to put it on probably 3-4 times during the day. Okay,
now you do much more than neck lifts. We're focusing on this, but we've got calls coming in with other questions pertaining to plastic surgery. We need to go to a quick break here. But for more information about Dr. Randall Weil, you can call 415-781-2081 or go to randallweil.com. And the first 15 callers who mention Body Beautiful, you'll be able to receive a complimentary consultation and $25 off an injectable treatment. When we come back on Body Beautiful, we will continue our chat about neck lifts and many sorts of plastic surgery with Dr. Randall Weil. We'll be taking your calls. We'll be right back. And welcome back to Body Beautiful. We'll be taking your calls with any questions you might have for Dr. Weil about neck lifts or any kind of plastic surgery. Here's the phone number, 800-440-4884. And again, we'll be putting the number for the doctor's office up during and after the segment. So be ready with your pen and paper to jot that number down. And remember, any advice we give you today, of course, you're going to also want to consult your own physician. Okay, we've been concentrating on the neck, but you also mentioned about, you know, the hands. That's kind of a new area, right? We've neglected the hands, but there are laser treatments or things we can do with the hands?
Yes, I think the two main things now for the hands, sometimes people who have really thin hands, you can do fat injections into the hands. So that'll plump them up, because people, when women get older, they are concerned that their hands look thin, and so they like to get them a little fuller. So fat injections work. You take fat from the tummy and put it in the hands. The other thing with the hands is that there's something called a photofacial, or an intense pulse light machine. People need maybe 3, 4, 5 different treatments. Each takes about a half hour or so. And
that takes care of maybe the sun damage, the brown spots.
Correct. That's exactly what it does.
Now, you alluded to something about fat injections, and is that a new trend too, to kind of plump things up? Because in youth we see that, and then as we age, things kind of...
Yes, it's not exactly new. It's been around a few years, but it's something, unfortunately, which doesn't last forever. Some people think that putting fat into your own body from another place on your body will last forever. No, it doesn't. It's several months worth. But yes, it's used frequently in the area of the cheeks or the lips or the nose-lip lines, that type of thing. So it's a procedure that takes about a half hour to do.
Now, we have phone calls coming in, and I do want to get some of the callers' questions on, but you also brought some before and after pictures. So let's go ahead and take a quick look at that. Our first picture here. This is someone
Yes, this is a woman who is in her mid to late 50s, and she was concerned about her neck. That was the thing that bothered her mostly, not so much the face. So this is just strictly what's considered the neck lift. So there is some suction, some liposuction into the neck, and then the tightening of the skin. She would definitely have extra skin, so you wouldn't want to just do suction.
Now, she's much more defined.
Yes.
But nothing else is...
That's it. That's all.
Okay, all right. Next picture. What's happening here?
This is a woman who had had some significant weight loss. So we see patients that have had fairly significant weight losses of maybe 100 pounds. And they come in with some extra skin. And so those folks, again, sometimes they just need the area of the neck. So these incisions are behind the ear and into the hairline. And it contours the jowls and the neck really quite nicely.
Now, what's the protocol and the healing process here? This is, I mean, somebody needs to take time off work.
Yes, I would say at least a week. A week should do it. So a Monday to a Monday should do it. And people will be bruised for a few days. They'll have some usual the swelling, which may last for 3, 4 days. But I'd say by 1 week, people are in really good shape to go back.
Now, you talked a little bit during the break about, you know, the trend now in plastic surgery is to have mini procedures, not just one massive thing where all of a sudden your friends say, who are you anyway?
Right.
And why is that?
I think a lot of people now like the idea of maintenance. So men and women, when they're in their, probably I'll see them starting now in their mid-40s, and they'll do smaller things. And these are things that may have a downtime of 3 to 4 days, maybe suction of the neck, or maybe your upper lids, or taking fat out of the lower lids, something small, which over a period of time will last for long periods of time, and you'll continue to look good instead of really start to decrease significantly and then need something large.
Now, I've got some phone calls here, and I hope we have a little bit of time to take one of them. Yolanda from Belmont, do you have a question for the doctor?
Okay.
Hi, Yolanda, you're on the air.
Yes, I wanted to ask that question for real. I didn't want to go on the program.
Oh, okay, all right. Well, we'll take you then off the air if she doesn't want to actually be asking the question on the air. Okay, well, I guess it is kind of a confidential question, so we'll leave it between the doctor and the patient. We'll keep Yolanda on the line. Yolanda, we'll get to you right after we get off the air. Is the trend again, we talked about just the minor stuff, is it also just the idea of less invasive? I mean, are people just... I mean, let me just get right to it, but are they a little bit afraid of the scalpel and they're just more predisposed to saying, well, I'll just take a little injectable, or...
Oh, yes,
maybe...
for sure, absolutely. I think people, sometimes they'll come in, and instead of having a massive procedure, which everyone is always worried about, number one's for the amount of extra time that's off, the amount of finances that's going to be involved, you can do small things. Maybe injectables would work well, but things where you can keep the price tag down and still do enough that someone's going to look better and feel better.
Okay, well, thank you. Unfortunately, we are out of time. I'm not going to be able to get to the rest of the calls here, but for more information about Dr. Randall Weil, you can call 415-781-2081 or go to randallweil.com.